No woman should die during childbirth, but unfortunately they do. According to the World Health Organization, 1 in 5 women in low and middle income countries like us die during childbirth, and the major cause is postpartum hemorrhage. What is postpartum hemorrhage? Postpartum hemorrhage refers to blood loss of greater than or equal to 500 ml of blood following delivery. So 500 ml of blood is half a liter. So if you have a liter of water at home, half of that. If a woman loses that quantity of blood during delivery, it's referred to as postpartum hemorrhage and is the leading cause of maternal death worldwide. What are the causes of postpartum hemorrhage? There are 4 main causes of postpartum hemorrhage. The first and commonest is what we call uterine atony. Uterine atony means that the womb does not contract. So the uterine means the womb. The womb does not contract. This is what happens in 80% of cases. This is what causes 80% of postpartum hemorrhages. So there are many reasons. Usually when a baby leaves the womb during delivery and the placenta, everything is supposed to go out, so the womb contracts back to its original size. But for some reason, sometimes maybe the patient has taken some traditional herbs, and for some many other reasons, the womb does not contract, and it causes the woman to lose a lot of blood. Those blood vessels are in the womb, supplying the womb during the pregnancy. They start bleeding, and the woman lost a lot of blood. So this is a main cause of postpartum hemorrhage. The second cause is trauma. The woman has a tear after delivery, maybe of the vagina, the cervix, all the parts involved in delivery, or even the uterine. The womb can rupture. This can cause postpartum hemorrhage, and if not managed properly, can lead to death. The third cause is tissue, which is in the placenta, which supplies the baby during pregnancy, remains in the womb. It will make the womb not be able to contract, because the womb is a small, let me just say, like a small ball. So when the baby is out, it wants to go back to its original state, like this, like a fist. But if the placenta is still there, it's not going to contract like that. So there's going to be bleeding and so on. And if the placenta too, for some reason, just attaches to the womb, it just says, I don't want to let you go. The womb wants to contract, it's only there, very attached abnormally, it will cause bleeding. The fourth cause is thrombus, which means that if you have a bleeding disorder, there are some people that because of a condition, they have a genetic condition, if they cut themselves, maybe with a blade or a knife, they're going to bleed excessively. So when they have a tear or any manipulation during delivery that causes bleeding, they're going to lose a lot of blood and can cause postpartum hemorrhage and even death. The good news is that postpartum hemorrhage can be prevented. A study has been done in 4 African countries, Nigeria, Kenya, Tanzania, and South Africa, where after vaginal delivery, blood was quantified using drip. So when a woman bleeds, normally we used to just look and say, oh, this is like 150, but now they had what they put under the woman's buttocks to ensure that they know the amount of blood she has lost. And then from there, if it is 500 cc's and above, they massage her womb, they give her drugs that can help contract the uterus, they give her drips, IV fluids, then they examine the genital area. If there's any tear, the suture, if the bleeding is still persisting, they take to the theater. And they realize that when they do this in these hospitals, the complications due to postpartum hemorrhage drastically reduced to about 1% compared to other hospitals that were not doing it. In Cameroon, this study is being implemented since 2024 at the regional hospital Limbe, where after a woman has a blood loss of 500 cc's and more, we do her massage of the uterus, massage of the womb, we give her oxytocin, give her those drugs that help to contract the uterus, we give her IV fluids, we examine the genital tract and suture if there's any tear, and we even send to the theater if there's any need for that. So doing this for more than 1 year has resulted in no maternal death, no woman has lost her womb due to postpartum hemorrhage, and so it's currently being implemented too at Boya Regional Hospital. And in recent times, we even have what has made the work very easy, what we call the maternal well trace, which is just put under the buttocks of a woman. Those who have given birth at Regional Hospital Boya and Limbe recently can confirm this information. So there are blue trays that are put under the buttocks, and it just measures the blood loss. If it's 500 cc's, the medications are just given to the woman, because we do not want mothers to die during childbirth. And we are hoping that all medical personnel can get this information and implement it in the various hospitals. For medical personnel, you can get to me. I'm the project manager in charge of implementing the emotive treatment bundle. sponsored by the American College of Obstetricians and Gynecologists, currently implementing it in Cameroon by the Cameroon-Arizona Partnership. So while we're in Cameroon, if you're in a private institution or public institution, you can get to me, let's work and see how to implement this treatment bundle to prevent and treat postpartum hemorrhage so that mothers should not die due to postpartum hemorrhage. Hopefully, this implementation is going to spread to other African countries. And while it's in Cameroon, let's make use of this information and prevent postpartum hemorrhage and prevent women from dying during delivery. Thank you so much for watching and staying tuned. And don't forget to like and subscribe. And most importantly, share this video to all people working in health, private and public institutions, so that we can discuss better on how to prevent postpartum hemorrhage, and also the women, so that she reach every woman, so that she should know her own role to play in prevention of postpartum hemorrhage. And until next time, bye bye.